All right. Hi, how are ya? I am waiting for people to show up. And as you get in here, I'm Dr. Suzannah Bozzone, and I'm coming to you from Chattanooga, Tennessee. So please let me know who you are or where you're coming from. And then we'll get going on this conversation about menopause, the wisdom years of power and respect. And that is really the purpose, is to really reframe what might have been previously perceived as something negative and see where we can find power amongst perimenopause and menopause. So hi, Laura. Oh, you're from Louisiana. Fantastic. Good to have you here. And again, anything that you want. So this is really about you guys, not about me finishing my slides, if you will, but I'm going to get going in here. And if you have comments, please put them in the comment section, or questions, or anything that you really want to share that you think is appropriate for this topic. Please type your questions or comments into the chat. So let's really get into this space. And if you don't mind, just having a little moment to tie into this moment. So to really lower your cortisol, I'm going to teach you a breath. We're going to do a physiologic sigh. So maybe inhale through your nose. Second quick inhale through your nose. Feel that swirl of breath as you expand, and then exhale out your mouth. Now feel your feet on the ground, feel your shoulder blades lower down. And let's get into this topic for today. So think about, as you maybe continue those breaths to lower your cortisol, to be in this present moment, what comes up when you think about perimenopause or menopause? Menstrual problems, more periods more close together, maybe periods heavier, maybe low energy or libido struggles with weight, stress around this time period, which can be because of this time period, or can be just contributing to the perimenopause phase. Hot flashes comes up a lot. Bone health and concerns for osteoporosis, maybe some brain fog, and maybe some mood swings or other mood struggles. So think about that for you, and maybe throw in there if you've had any really strong symptoms or concerns or thoughts around perimenopause that are not on that list. And I'm just going to go through some basics about what's happening in perimenopause and menopause, just so we're all speaking the same language. And so perimenopause can last as long as 8 years leading up to menopause. And now menopause is one day. It is 1 year, the complete cessation of ovulation and menstruation for 1 year. So that is menopause, which is kind of strange to think about, right? And so we have perimenopause that leads up into it. And that's really what's giving us a lot of these symptoms. And that's where we begin to see this decline in estrogen, where it's very hard because we have a limited number of eggs that we need to ovulate. And so the hormones are kind of going all over the place, trying to push those last remaining eggs out. And so this can cause a lot of disruptions and a lot of ups and downs in our hormones, in our moods, and in many other things, as well as irregular periods, because we're not totally sure when we're finally going to ovulate that egg and when the menstrual cycle might occur. And so often you'll see changes in the periods that occur, and they often become more frequent before they stop. They're often heavier before they go lighter, and you might have hot flashes and sleep changes. That's a big one. Sleep changes, urinary changes as that estrogen drives down. Laura mentions battling mood swings. Absolutely, you're not alone with that. And then, of course, the vaginal and libido symptoms that can occur. And so what I want you to kind of notice is, as these transitions and as these symptoms occur, I'm by no means trying to put this in a light where we're all looking forward to it and we're all celebrating the mood swings and all of these hormonal changes, but do kind of notice what our focus is on. Because historically, menopause, and just even the word menopause, means the pause of menstruation. So it's talking about what we're lacking. We are no longer menstruating. And so we're really focusing on what's lacking in that. And often when you hear the discussion about menopause, the discussion is about, oh, you're lacking estrogen, right? You're deficient in estrogen. And that really puts this in a light that's very negative. And if you have ever heard me talk before or think about anything that I talk with patients about, it's really about our perspective, because our perspective or our perception so largely creates our reality. That's true of stress, right? Stress doesn't cause disease, but our perception of the event can. And so in looking at your relationship with perimenopause or menopause, I really want you to think about how you perceive it. Oh my gosh, I'm dreading this. This is the end of my life. Or is it, can you find something powerful or even freeing about not having periods? I think many of us probably could if we thought about that. And so see if you're focusing on the negative symptoms, because that is not uncommon. And these negative symptoms can really drive what happens if we let them. And that would be the 7 dwarfs of menopause. If you don't know them, they're itchy, bitchy, sweaty, sleepy, bloated, forgetful, and psycho. And so if those are where our focus lies, we're going to miss some opportunity to find something positive about this transition. So what do I mean? What could possibly be positive about menopause or about this phase of life? Well, look at Japan. And it's really important to look at Japan for a lot of reasons. Not only is Okinawa, Japan, one of our blue zones, the longest living female population in the world, but the way the Japanese embrace this phase of life or how they seems very different than the American or my historic cultural perception of this event. So the Japanese word for menopause is konenki, and I'm probably mispronouncing that, so forgive me if I am. But apparently this means the renewal or regeneration, or the season of renewal and regeneration. And that's so powerful to consider. And so then think about, well, maybe, of course, we have to look culturally. That's never just one thing. How do the Japanese women live historically? What have they eaten? How do they move? How do they tie in? What's the culture connection, which is so very important? But is it possible that their perception of this event might be yet another feature of why they live so long, having fewer chronic diseases, less osteoporosis, a third of the cases of breast cancer, despite having fewer and older pregnancies? And that's kind of important, right? Because those two pieces can be protective in breast cancer. But despite not having those components that we know are seem to be protective in breast cancer, they still have a third the case of breast cancer. So just recognize how the culture might be something that connotates how we perceive this transition, and how that might play a role in the transition that we have and the symptoms that we endorse. So this is my invitation to you to just consider how to create your menopausal identity. So visualize or write menopausal traits that you want to personify. What is it in this time of life that you'd really like to see? Well, I'd always want to see purpose driven. And this is a time where sometimes there's less chaos in our life to distract us from truly what do we want. We have this recognition, we have this awareness that life, as far as we know, is limited. And so we know at this time in our life, truly, hopefully we have a connection as to what we are striving for, really why we get up in the morning. And that would be your ikigai, right? In the Japanese language, why you get up in the morning, that purpose-driven life. But think about traits. And so maybe you want to comment in the comments about traits that you would want to take on in this time period, whether you're before, during, or after this transition. Power, grace. I mean, think of the coolest women, the coolest menopausal women that you know. Humor, right? I mean, and they can say anything they want, and they just have this power and this ability to do anything that is. So we really want to cultivate those traits in our menopausal years as much as we can. Adventurous, right? You have the time, perhaps, hopefully the health and vitality, and if not, work with your provider to get that health and vitality to do the things you always imagined and have the energy to do them. to be cultured, influential, free, sexy, badass, graceful, wise. And this is a generation that is celebrated in the Japanese culture, that actually increases in its level of esteem in the culture. So something to think about in that, and perhaps comment on what you'd like to see in your menopausal years and what you'd like to see menopausal women embrace today. So let's talk a little bit about what's happening in these years. So premenopause, this is just a a graph that shows you what are your hormones doing. And you can see in the premenopause years, while it does look a little bit chaotic, it's actually quite regular. It looks very much like an EKG, right? You have these spikes that are anticipated and regular, and in that you have large spikes. In that there's ovulation at a relatively regular time, somewhere around 28 days, rarely 28 days exactly all the time. Those fluctuate, but more or less you have a monthly cycle, and with that monthly cycle, you have monthly ovulation, mid-cycle, and then the first day of your cycle heralds that first day of your bleed. And then hits perimenopause, and look what happens. Oh my God, what is happening there? It's all over the map. And you can see that, again, this is a shift from reproductivity to what we hope is still very productive, but where our focus is no longer on reproduction as we go into peri and postmenopause. And the symptoms that we relate to this time period are related to these complete, just crazy fluctuations in the hormones. And then you see things really stabilize in postmenopause. And often our symptoms, or many of the symptoms, the predominant symptoms, the hot flashes and the huge fluctuations in mood and so on, really tend to stabilize as those hormones kind of stabilize more as well. So what does this chaos comes from? Well, it stems from the hormonal surges necessary to ovulate those final remaining eggs. And so when you're born, you have a quantity of eggs, and that's all you'll ever get. And so when a woman is born, she has all of her eggs, which is about 1 million eggs, and they are being destroyed as time goes on. And even by puberty, even before first menstruation, you only have about 300,000 remaining. By the age of 30, you have 10% of those eggs, and by the age of 40, 3%. So you see that those eggs, because every time one egg comes out, there's all these others that are kind of fighting for the charge, and they get lost in the process. And so in that, when you have so few eggs remaining, your hormones, again, are trying to get that follicular stimulating hormone is like, come on. And then your estrogen goes, oh, here we go. And so everybody's just chaotic all around there. And that's where those symptoms come from. And so this is kind of an old slide. This comes from a study that was in 2015. And when you look at the stats today, these numbers are actually quite underestimated, I believe. So hot flushes back in 2015, they said, based on this pretty large study, 40%. Well, now when you look at the data, it seems to be up to 80%. Is that a change in population, or was it underestimated? It's hard to say. But other common symptoms: night sweats, insomnia, vaginal dryness, mood disorders, weight gain, and brain fog often missed. And what's really important to recognize when you're talking about perimenopausal symptoms is that so often hot flashes are like the only thing that people talk about. And why is that? Well, hot flashes are kind of the specific symptom to menopause or perimenopause. And so for that, it seems to be all that's talked about. But did you know that, say, frozen shoulder, that's adhesive capsulitis, that inflammatory kind of joint conditions are also a major symptom, often not talked about because, of course, that's not really specific to menopause and perimenopause, but it certainly increases in this transition. Brain fog, also something similar, not often or not up until recently talked about very much, but it affects over 60% of peri and postmenopausal women. I'm trying to see, I see some comments coming in. Oh, okay. So we're having, I guess apparently you can't see my slides. I'm not sure what's going on there. But hopefully you can hear me. And as we go through, I'll just try to explain what they show. And then hopefully you can watch this later. And so I see a question from Lori, still getting hot flashes. How much soy should I eat to help with that and my osteoporosis? Great question. And so we'll go into soy a little bit. A half a cup of soybeans was what was used in Neil Barnard's study, which helps significantly with hot flashes. So that would certainly be something to look into. Also, you do want to just get checked out, make sure you have labs done to say that there's no other reason for the hot flashes or persistent symptoms. Look at your thyroid, look at other symptoms to just make sure, make sure your weight's stable and other things that can be associated with hot flashes. But assuming that is persistent from menopause, then certainly half a cup of soy would be a good place to start, and work with your provider for other suggestions. For osteoporosis, weight-bearing exercise and don't fall down. So balance exercise. If you can look up the old man test, and I love that it's called the old man test and not the old woman test somehow, but it's just working with balance, standing on one foot for 10 seconds, really recognizing what we can do, because we have to train our brain in balance to not fall down. And if we don't use it, we absolutely lose it. And this is harder for some people than others. So working with Tai Chi or yoga, some balance exercises, making sure you're looking to not fall down, and also supporting sufficient protein as well as calcium-rich foods. I do not generally recommend calcium supplementation, but resistance weight-bearing exercises are key. So work with someone to help you do that in a safe way to prevent injury. And I am going to reshare my slides, apparently. Hold on just a second. And hopefully I will do this stop screen share. Thank you for your patience here. And by all means, present. Here we go. I'm sharing screen. Share screen. Okay. How about now? How are we doing? Is that any better? Hopefully that works. I'm gonna keep on going, but do let me know. We've got it. All right. Hallelujah. Okay, so we left off at brain fog, ironically. But wait, yes, there's more. While hot flashes seem to dominate the conversation because, again, they are the most specific and most researched in terms of what helps menopause. Well, it's really, the question has largely been what helps hot flashes more than what helps all the other symptoms of menopause. And so we don't have a lot of great data on that. And it's only just now coming out, particularly brain health and so on. So again, I mentioned musculoskeletal symptoms. This is really big. Frozen shoulder being a very frequent symptom of perimenopause that many of us aren't aware of, and many doctors are not aware of as well. And then, of course, weight gain, and anxiety and mood struggles. So one thing I do want to point out is that 10 to 25% of women actually don't have menopausal symptoms. And so at this time, when we talk about treatments, and of course, hormone replacement is on the table for many, many people. And we went from this kind of don't give anyone hormone replacement after the Women's Health Initiative to now we're kind of swinging where you could just pull up many a podcast and hear everyone say everyone needs hormones. And I think the answer is somewhere in the middle, and we're still trying to determine truly what the answer is there. So as always, stay tuned for the indications on that as they are evolving. And I'll talk about what they are for hormone replacement in just a moment. But at this point, we don't have enough evidence to support the use of hormone replacement if you don't have any symptoms. If it ain't broke, don't fix it, right? Menopause is not a disease condition. This is a normal condition, a normal transition for every woman in her life. So we shouldn't really perceive it as a disease state. That said, if your quality of life is suffering, your ability to engage in what matters most, and you're a reasonable candidate without contraindications for hormone replacement, then my goodness, if hot flashes are disabling you, then certainly consider those and see if you're a right candidate for those, if they help you live your best life. So the goal, and someone I think asked, I saw something go by about labs, and I want you to know that there are no labs that define perimenopause, and I wish there were, but there's not. And so really perimenopause is defined by the fluctuation of those hormones. And so when we check hormones on people, they could be different hour to hour, certainly day to day. So the significance of what that means, and if people are kind of putting you in a box like they should be in this optimal range, well, there's really not data to say that there's any use in doing that, because you can have very high levels of hormones and have horrible symptoms, or very low levels of hormones and have horrible symptoms, or have no symptoms. Right. So they don't correlate with the outcomes, which is really treated clinically based on the symptoms that you have. So the only reason really why we would check labs in that perimenopausal time is to make sure it's not something else. Is there some other reason, like for your thyroid, for example, that your temperature regulation seems to be thrown off? So talk about cholesterol on hormones, plant-based eaters. Hold on just a second. Many plant-based eaters have low cholesterol. Is there such a thing as too low for adequate hormone production? Very good question. Thank you for asking that, Alexa. So yes, in the perimenopause and menopausal transition, your estrogen will decrease. That is normally what happens. And in that shift, what we see, and actually, I do have a slide on this, so let me roll through that really fast, just because I know if you are a visual person, then let's do that. So actually, I will address that question in just a moment, if you don't mind. So just talking about hot flashes for a few moments. Why does this happen, and what are they? Well, it's sudden warmth in the body, especially the face, neck, and chest. And if they occur at night, then they're night sweats. Of course, there are other things that can cause night sweats. So you do want to make sure that if these aren't classic, if it's not a classic time for these symptoms, or there's anything unusual, that you look into that with your provider. But that said, the thermostat seems to be more sensitive to slight changes, and that's what seems to be causing or driving those hot flashes. They affect, again, some say as high as 80% of women, and they can last as long as 7 to 9 years. They can last much shorter than that, but in a third of women, they last even more than 10 years. And so this question about the soybeans, this is the study here by Neil Barnard, and if you wanted to look at that study, you can see exactly what he did. Those were Laura's soybeans. You can even buy Laura's soybeans and eat half a cup a day to do exactly what he did in the protocol. Because what he showed was that hot flashes reduced by as much as 84% in that population. We also see data that suggests that regular soy, and when I say regular soy consumption, I'm always talking about minimally processed soy. I am never going to be recommending highly processed foods, soy protein isolate, or otherwise highly processed foods, whether it's vegan or not vegan, are not part of the most health promoting diet that's going to reduce inflammation and reduce your cardiovascular risk, and so on. So just so that you know that, I'm talking about things like edamame, tempeh, tofu, unsweetened. I prefer organic, certainly non-GMO soy products is where kind of I stay. Soy curls are fine as well. But there is data to suggest that this improves bone health. I do want you to know that the NAMS, the North American Menopausal Society, it's interesting. They do recommend weight loss to help support hot flashes if you are overweight, but they don't believe that the evidence is strong enough to suggest any specific dietary recommendations or even exercise recommendations, but they do suggest weight loss. So that's just something kind of interesting. And I'm going to give you some tips on how I would tend to go about that weight loss to reduce your risk of chronic diseases, and also with smaller studies, but still significant evidence to suggest benefit in the perimenopause and menopause transition of life. So other things that can drive more hot flashes: alcohol, high stress, being sedentary, smoking, and again, having a high body mass index, or the overweight or obese areas there. And so just talking about medications and estrogen receptor, estrogen replacement, if you do have a uterus, in other words, if you have not had a hysterectomy and you don't have contraindications to hormones, this might be a very reasonable thing, and in fact, very helpful treatment for you. And so talk to your provider if this is right for you. The reasons you do not want to take would certainly be breast cancer, uterine cancer, any hormone-driven cancers, active clotting disorders, or heart attacks, migraines with aura, or chronic liver disease. There is a new medication out that is a non-hormonal form of medication that works through neurokinin receptor to help with hot flashes that is not hormonally based. So just so that you know that. And so this is now going to talk through the link between menopause and cholesterol, just as Alexis had asked. And so as our estrogen reduces, then we tend to get more insulin resistance. But what also happens is we seem to absorb more cholesterol as well. So we will often see these metabolic shifts with weight gain. As we increase our insulin resistance, we increase our insulin and that fat storage. We see these shifts in our body composition, sadly, where there's more kind of fat, particularly visceral fat that we don't want, and it's harder to build muscle. So we have a little bit of muscle loss. So that's why it's so important not just to look at the scale, which can be very misleading, but to look at body composition, and that the goal is not just losing weight, right? We could just take a GLP-1 agonist and lose loads of weight, but if we're losing 40% lean muscle mass, that's really not our goal for supporting healthy menopausal years and bone health. So resistance training is really, really important. And also in terms of cholesterol, there is no too low level of cholesterol to eat. You do not need to eat cholesterol. Your liver makes cholesterol, and it makes sufficient amounts of cholesterol to do the important roles it has in your body, including hormones. But having a higher cholesterol, you'll see that on TikTok and other places. And so having higher cholesterol is absolutely linked, particularly higher LDLs or ApoBs is linked to more cardiovascular disease. It is not linked to better menopausal health or better hormone production. So absolutely, we do not want our cholesterol to be higher. And I see a question. I've had a hysterectomy, but I have ovaries, so I suppose that I am in menopause. However, I'm wondering if the uterus produces hormones. I'm low energy and losing my hair. Gah. I like the gah. Okay, so that doesn't mean that you're in menopause. If you have ovaries and if they're still working, then you may or may not be in menopause. It depends on what your ovaries are doing. You just don't know if you're bleeding because because of the hysterectomy, because your uterus has been removed. So sometimes you can have surgically induced menopause. That would mean taking your ovaries out. But sometimes having surgery or a big stressor like that does kind of prompt the ovaries to putter out as well. But really the way to know that would be based on an FSH level, of follicular stimulating hormone. Your brain still signals to your ovaries whether they should ovulate or not. And when the FSH goes really high up in menopausal levels, then that's really can tell us if we're menopausal. Again, what I mentioned before was there are no blood tests to tell you if you're perimenopausal, but menopausal is really defined by 1 year without a period and a high FSH, particularly if you don't know, because you've had your uterus removed, you don't know if you're having a period, or you're not sure if you're ovulating or not because you're not having periods. And so the way to test that would be an FSH. Okay, so I just want us to recognize a few things that can also drive more hormonal symptoms. And I'm going to focus in on weight loss. But again, if you have any questions, please put them into the chat as much as you can. And just to recognize that when 75% of Americans today are struggling with overweight or obesity, this is really important to recognize that where does estrogen also come from? It comes from it is produced also in the fat cells. But what's interesting, and let me go back to this slide. So it's converted via aromatase in fat cells. That's why for certain breast cancers, they'll give aromatase inhibitors to try to reduce that estrogen level. But interestingly, what's made there is kind of a different estrogen. That's really estrone. And it's thought, perhaps is the body trying to increase fat to produce more estrogen? I don't really know. I don't think anyone really knows that. But what we do see is you would think that if we had more fat cells, that we would produce more estrogen and we'd have lower menopausal symptoms. But quite the opposite is true. When we struggle with overweight or obesity, we see a clear link with generally worse menopausal symptoms. So healthy weight loss is recommended by the North American Menopausal Society and others, because we clearly see that if we get to a healthy weight, I'm flying through these slides right now just because I know that we're running out of time and I want to kind of get to the major questions here. But getting to a healthy weight, and that is not just a weight, that's a healthy body composition, really focusing in on strong muscles and strong bones, as well as reducing excess fat as in a compassionate way is really important. So weight loss has actually been shown to be a treatment for hot flashes. And this, of course, is in women who are overweight, not in women who are of normal weight. But how these women in this study did it was through exercise at 40 minutes a day and some calorie reduction. And they found that significant reduction in hot flash frequency over 6 months. And for every 11 pounds they lost, they improved another 33%. So really important to address this in a compassionate way and know that there's many ways to go about doing this. And when we lose weight, again, we want to maintain our muscle mass, and we want to do this in a way that's sustainable, that also reduces chronic disease risk and inflammation. Because I know that there's many ways to lose weight out there, but one of them being just cutting off body parts, right? But that wouldn't get you to your finest self. So we want to do this in a way that we know supports metabolic health. And that's really increasing your variety of fiber in your diet, 30 species or more per week. And that can support your microbiome. Your microbiome, there's a subset of your microbiome called the estrobolome that is really there to regulate your estrogen. So again, it's not really about the estrogen level. It's about what we do with it, how we utilize it, and how it can support us living our best life. So reducing processed foods and increasing fiber-rich foods is so important to that. And ground flax, minimally processed soy, dark leafy greens that really support so much of your body, and healthy weight loss, as well as healthy blood flow and everything else, are really important for this. And so I'm going to read some of your comments here. And again, please, any questions you want me to go through. I knew going into this I would never finish my slides, and so I just really want to address what questions you have. I had to go on birth control in 2021 for fibroids and endometriosis, but I still have my uterus and one ovary. Is that considered menopause? No, not at all. You still have one ovary, and I think just switched. So no, you are not in menopause unless you, unless that ovary is no longer working, but you have one working ovary. And it might be hard to know, particularly if you're on a birth control that makes you not bleed. It might be hard to know where you are in that. I don't know what your age or other symptoms are. I don't take a week off the birth control every month to get a period. Okay, so you should definitely work with your provider on wherever you are with that. There are really wonderful ways to address the underlying driver of fibroids and endometriosis, which are many. And we can certainly talk more about that, but I would encourage you to work with a provider. But recognizing that often there are certain things. Red meat, for example, drives more endometriosis, heavier periods often. So I'm not sure what you're eating right now or what you're doing, but increasing things like ground flax, increasing plant-based choices, reducing red meat. And I know sometimes, especially when women are bleeding a lot, their doctors are like, eat more red meat for the iron. But in fact, we see a clear link between more red meat consumption and heavier periods and endometriosis. So what endometriosis is really looking at hormone balance. If you can increase your lignans through ground flax, tahini, substances like that, try to reduce inflammatory drivers that really get that those prostaglandins going, that drive a lot of the cramping and symptoms like that. So increase ground flax, tahini, dark leafy greens. Try to replace your red meat consumption with other protein sources that are lower, so unsaturated fat sources, and particularly that are high in fiber. So shift to beans beans, and even soy, right? So often you have, and I don't use the word estrogen dominance, but often you have more kind of relative estrogen in that situation that makes the uterine lining grow. And we want to stabilize that as much as we can. So utilizing soy, but working with a provider to really help you, because it sounds like you got a lot going on. So thank you for being part of this Love Life series. I recently got on thyroid medications, and I'm curious if it's possible to come off them over time. Asking in general, I have a PCP appointment in July. Okay, great. So thyroid's a tricky thing, and of course, the longer you've been on them, the more likely that you'll stay on them. I have seen patients go off of them. The goal really is to recognize, and I do love. I think that the book Adrenal Thyroid Revolution by Aviva Ram, she goes into the interplay between the thyroid, your adrenal glands, stress, and other things. I think that it's not uncommon that people are treated for thyroid at very questionable at lab tests that don't necessarily show a low thyroid, but if they have other symptoms, providers really want to do something, and so they'll throw people on thyroid medication. So just be conscious of that, because a lot of times those borderline thyroid labs reflect perhaps a high stress or other things going on. So when you look at the thyroid, you want to not just look at nutrition. You really want to look at stress, sleep, other things that play a major role in your thyroid regulation. And so it's very much a whole body gland, if you will. And the goal and success is not driven by being on no medication. If you need a little bit of thyroid to feel your best, then that's perfect, right? If perhaps you are able to get off of it, then as long as you're living your best life, that's really the end point, that you have the energy and vitality to do what you're on this planet to do. Whether or not you're on medications does not create any more or less failure or value or anything like that. So I hope that that's helpful. Okay, any other questions? And I know we're kind of running out of time here. There was a question about soy. And certainly I would suggest supporting soy, regular soy, or I like organic and minimally processed soy, dark leafy greens. We talked about shifting red meat. Shifting alcohol is really, really important as well. If alcohol is a regular thing for you, just know that the closer we get to perimenopause, man, it is not our friends. And I know it's sad, but we need to really embrace other means of stress management. So the alcohol really wipes out your microbiome. Your microbiome is so important to create the environment where your genes find themselves, where your hormones regulate themselves. So in the nutshell, what we really want to look is holistically, with power, with grace, and find your best self through this menopausal transition, through the choices that really truly reward you towards your best self. And sometimes those choices are different than what we previously thought of as a reward, like cake and alcohol. So I hope that this helps, and do feel free to send us any questions or other comments, and help us know what else we can provide to you in terms of information that you would like to hear more on. So thank you so much for your time. I believe that we are out of time. So I am going to let you all go, and I hope that this has been helpful for you guys.